Good morning and Happy New Year. I would like to thank Schmidt Futures and the Social Science Research Council for hosting this forum, especially Eric Schmidt and Barbara Bush for the invitation to share a few reflections with you today. I also send my greetings to Dr. George Gao, Sir Jeremy Farrar, Dr. Victor Zhao, Dr. John Ken Gasong, Dr. Chikwe, Dr. Vivek Murthy, Dr. Gail Smith, Dr. Tony Fauci, and Professor Kaz Sunstein and Chris Kirchhoff. I would also like to recognize Alondra Nelson at the Social Sciences Research Council and the 18,000 social scientists in 80 countries among its membership, many of whom are studying COVID. Perhaps the expression Happy New Year has never meant more. For millions of people, 2020 was not a happy year. It was a year of uncertainty, fear, and grief. Many challenges still lie ahead, but there are also many reasons to hope that 2021 will be a happier year. Vaccines are giving us real hope of bringing the pandemic under control in the next 12 months. 42 countries have now started vaccinating their high-risk populations. However, all of them are high or upper middle-income countries. This is a problem that's getting worse as some countries pursue new deals offering higher prices to manufacturers. This is not only a betrayal of the world's poorest and most vulnerable people, it's also self-defeating. The fastest road to recovery is by sharing vaccines and ensuring that health workers, older people, and other at-risk groups are vaccinated in all countries. Almost 90 million cases of COVID-19 have been reported to WHO, and close to 2 million people have lost their lives. I know that so many of you have been personally affected by the pandemic in one way or another. I offer my deep condolences to those of you who have lost someone you love. And I offer my deep gratitude to your health workers who have put themselves in harm's way to serve and save others. Although this is a global pandemic, countries have responded differently, and countries have been affected differently. Around half of all cases and deaths are in just 5 countries, and 2/3 of cases and deaths are in just 10 countries. There are many different reasons for the wide variance in the way countries have responded. Understanding those reasons is essential for ensuring that we are all better prepared in future. So I commend Schmidt Futures for its focus on pandemic preparedness, and I welcome your new comparative study of the response to the pandemic in 23 countries, led by Wilmot James, Sheila Jasnov, and Stephen Hilgartner. Your work is helping to unravel why compliance with public health guidance was high in some places and low in others. I also commend Rebecca Catt and her team at Georgetown University on the launch of the Global Health Security Library, which will be a valuable resource. One of the first speeches I gave as Director General was at an event on pandemic preparedness at Columbia University in New York as the world approached the 100th anniversary of the 1918 flu pandemic. Although it killed more people than the First World War, the 1918 pandemic was eclipsed by the war, and its lessons went unheeded. I said in that speech of 2018 that a devastating epidemic can start in any country at any time, and kill millions of people because we're not prepared. I said that global health security is only as strong as its weakest link. No one is safe until we are all safe. And I said that we do not know where or when the next global pandemic will occur, but we do know that it will exact a terrible toll, both on human life and on the global economy. It may even cause political instability. More than 3 years later, we are unfortunately learning these lessons the hard way. The COVID-19 pandemic has demonstrated that indeed the world was not prepared. But as Winston Churchill said, we should never let a good crisis go to waste. We have an opportunity to learn and change together. And learn and change, we must. In July of last year, I launched the Independent Panel for Pandemic Preparedness and Response to conduct a comprehensive review of the global response to the pandemic. We have also established the Review Committee of the International Health Regulations to review the functioning of this vital legal instrument. The Global Preparedness Monitoring Board, established by WHO and the World Bank in 2018, has also completed 2 assessments of gaps in pandemic preparedness with recommendations. But several lessons are already staring us in the face. First, all countries must invest in preparedness capacities to prevent, detect, and mitigate emergencies of all kinds, whether they be naturally occurring epidemics or deliberate events. Strong primary health care is especially important as the eyes and ears of every health system and at the foundation of universal health coverage. In recent years, many countries have made enormous advances in medicine, but too many have neglected their basic public health systems, which are the bedrock for preventing, preparing for, detecting, and responding to outbreaks. Second, true preparedness is not just a job for the health sector. It requires an all-of-government and all-of-society approach. The pandemic has taught us that meeting the greatest health challenges needs all hands on deck, including the public and private sectors, civil society, and social and natural scientists working closely together. And third, the pandemic has highlighted the intimate links between the health of humans, animals, and planet, which we can only address with a One Health approach. Any efforts to improve human health are doomed unless they address the critical interface between humans and animals and the existential threat of climate change that's making our Earth less habitable. History tells us that this will not be the last pandemic, and epidemics are a fact of life. But with investments in public health, supported by an all-of-government, all-of-society, One Health approach, we can ensure that our children and their children inherit a safer, more resilient, and more sustainable world. I thank you.